Hi viewers, in today's video, let us discuss about white fungus, a more deadlier disease than the black fungus. White fungus is considered to be a more life-threatening condition than the black fungus, which is another post-COVID complication that is more deadlier than the black fungus or mucormycosis. The scientific name of white fungus is nothing but Candida, which is commonly seen in mouth, throat, skin, and the vaginal region. White fungus is a more dangerous condition than the black fungus or mucormycosis, which is more infectious and causes life-threatening problems in immunocompromised patients. This white fungus is more commonly affecting the lungs but also affects the skin, nails, mouth, stomach, kidney, brain, vagina and penis. The symptoms occur according to the site of the infection. Mostly the white fungus affects the lungs and the infection is similar to that of a COVID infection. The most common symptoms including cough, fever, chest pain and breathing difficulty is similar to that of the COVID patient. The CT findings are also similar so that it is difficult to differentiate COVID and the white fungal infections. Only high resolution computed tomography can be helpful in identifying this white fungus. White fungus in the mouth. When this white fungus affects the cheeks, mouth, tongue and the throat, you are able to see small white color patches in the mouth which gives the name of white fungus. The symptoms include cotton-like feeling in the mouth, pain during chewing, oral thrush, loss of taste, dysphagia or difficulty in swallowing. White fungus in the throat. From the mouth, this white fungus can enter into the lungs or sometimes it can enter into the food pipe or the esophagus. Sometimes it can also spread into the joints through the blood supply and can lead to severe myalgia or muscle pain or body pain. When this white fungus involves the nervous system, it can cause intense headache, seizures, confusion and difficulty in thinking process. The confirmation of the diagnosis is done by the use of a throat swab and is tested clinically. If you suspect that the white fungus has affected the food pipe or the esophagus, the sample is taken from the esophagus by an endoscopy. If the white fungus infects the vagina or the penis, the sample is taken from the infected area and is clinically examined. This white fungus is more life-threatening when the patient is immunocompromised. For those patients who are on steroids and antibiotic therapy, oxygen therapy used during the treatment of COVID-19. The high-risk patients include diabetic patients, cancer patients, patients who are on chemotherapy, HIV or AIDS patient, asthma and who are on steroids, smokers. As the symptom of COVID and white fungal infections of the lung are similar, it is difficult to differentiate both. The confirmation is usually done with RT-PCR and the throat swabs of the patient for candid infections. The treatment of the infection is done according to the area infected. The drug of choice can be micafusin, casperfusin, fluconazole, oriconazole, clotrimazole and amphotericin B. Prevention is better than cure. So, follow all the precautions to avoid COVID, get yourself vaccinated and try to improve your immunity levels by taking adequate nutritious diets. Not all the COVID patients get black fungus or white fungal infections. It is only 0.2% are affected with this fungal infection after a COVID exposure. The steps to prevent white fungal infections include maintaining adequate oral hygiene, You can also use mouthwashes, which is available in the pharmacies to prevent frequent oral infections. Rinse your mouth after using a nebulization if the medication is containing a steroid. Try to maintain adequate personal hygiene and try to keep your surroundings neat and clean always. All the equipments and the instruments that is used for the patients should be sterilized properly inside an hospital environment. Hope the information was useful. Thanks for watching and subscribe for more videos.